Dysphagia refers to difficulty with swallowing. Depending on the time of onset, dysphagia can be oropharyngeal dysphagia or esophageal dysphagia. If the time of onset immediately after swallow, then it is oropharyngeal dysphagia. If it is after few seconds of initiating the swallow, then it is esophageal dysphagia. Oropharyngeal dysphagia means difficulty during oral and pharyngeal phase of swallowing. A dedicated investigation is done to find out the cause of oropharyngeal dysphagia. The investigation is video fluoroscopic swallow study. It is a modification of barium swallow study where oral and pharyngeal phase of swallowing is observed to find out the cause. This one is the upper esophageal sphincter. It is relevant during swallowing because during swallowing the upper esophageal sphincter relaxes to allow the food bolus to pass. This one is a case of zenker's diverticulum. Zenker's diverticulum is a cause of oropharyngeal dysphagia. In this, there is a weakness in the posterior pharyngeal wall where the mucosa and submucosa prolapses, creating a pouch. This pouch is a site for collection of food. This food sometimes regurgitates, leading to regurgitation of the undigested food and halitosis. So these are the symptoms of zenker's diverticulum: oropharyngeal dysphagia, regurgitation of undigested food, and halitosis. Now, what is the mechanism of formation of zenker's diverticulum? We already know that inferior constrictor is an important muscle of pharynx. It has two fibers, the oblique fibers of thyropharynges, the horizontal fibers of cricopharynges, and the weak area is known as the Killian's ligations. The cricopharyngeus muscle of the hypopharynx forms the upper esophageal sphincter. Because of some neural incoordination, the cricopharyngeal muscle sometimes fails to relax. That is known as the cricopharyngeal spasm. Because of this spasm, the hypopharyngeal pressure increases during swallowing. This increase in the pressure leads to a pulsion of mucosa and submucosa through the Killian lesions, leading to a diverticulum, that is the pharyngeal diverticulum. Now understand this with a case example. This is a video fluoroscopic examination of a patient with oropharyngeal dysphagia. In this, we can observe that there is a prominent cricopharyngeus muscle. This is known as the cricopharyngeal spasm, and there is a tiny diverticulum arising from the posterior pharyngeal wall. This is the Zenker's diverticulum. This Zenker's diverticulum arises in the setting or association of cricopharyngeal spasm. Management of Zenker's diverticulum is excision of the pouch, that is diverticulectomy, or an endoscopic procedure where endoscopically the septum between the diverticular pouch and esophagus is cut to create a common cavity so that the food is not collected. The procedure is known as Dolman procedure. Now, today's learning is dysphagia refers to difficulty in swallowing, while odynophagia means painful swallowing. Video fluoroscopic swallow study done for oropharyngeal dysphagia. Zenker's diverticulum presents with oropharyngeal dysphagia, regurgitation of undigested food, and halitosis. Weakness or gap between thyropharyngeus and cricopharyngeus in the combination with cricopharyngeal spasm lead to development of outpouching in the posterior pharyngeal wall, that is known as the Zenker's diverticulum. Dolman procedure refers to cutting up the septum between the esophagus and diverticular pouch, creating a common cavity so that food is not collected.